of virtual session from the series that we started a number of months ago. We've been together off and on now for a better part of the year. So I'm excited to cap this out. We will be reconvening in person after the new year. We'll get that scheduled, and I'll talk about that in a moment. Today's topic is using data to promote an equitable and effective housing response. And as we all know, this series, I think many of you know me. My name is Doug Tatro with the Technical Assistance Collaborative. We are one of the TA providers that supports the federal government, states, COCs, in sort of all things ending homelessness. And I've had the pleasure to work with the state of New Hampshire over the years, and even more pleasure, as I always say, to actually be working with New Hampshire because I live here in Manchester. And oftentimes I'm working with communities in other parts of the country. So it's nice to do work at home. Good to see you all. Actually ran into a few folks this weekend, which was nice to see faces outside of Zoom. So this is the arc that we've been building now that's coming toward a close over this past number of months, beginning in April, focused on housing first as our general or kind of overarching theme throughout the year. With different caveats and carve-outs around that topic over time. And I just want to recall everyone's attention to where we started and where we are now. We started with that basic introduction around what housing-focused systems look like, what Housing First is and isn't. We then spent some time around system-level practices with coordinated entry and general coordination of resources. Then we moved into more program or project type specific discussions with a session that focused on outreach and shelter design, followed by rapid rehousing and permanent supportive housing design. And you can see slot 4 there was meant to be an in-person training that we were going to conduct last week, focused on direct care, really sort of targeted to frontline staff to start to dig in to some of the core skill sets that people use when working within a housing first environment. We did postpone that. We'll be connecting with leadership and with Christy around rescheduling that for the new year, I believe, and hopefully we'll be able to get in person for that. I would encourage you to be considering, if you are a program manager or director on the line, to consider your case management teams, your outreach teams, the folks that are working directly with clients for that in-person training once we get that scheduled. And today we're going to sort of land this plane talking about data and how we can think about data to promote both equity, but also in terms of holding ourselves and each other accountable to housing first principles or housing focused principles in our projects and across the community. I will say going into this session that I'm not a data scientist or statistician. I don't provide very in-depth HMIS TA, and there may be folks on this line today that are more fluent in or ingrained in data practices. So we're not going to get into data entry and the ins and outs of how to work in HMIS or what reports to run. This is really meant to bring some of these concepts together and talk about how data is used, but also what are the core questions that we want to answer and how do we think about going about answering those questions as we evaluate our own commitments toward housing focused practices, housing first practices, as well as promoting equity across the state, across the balance of state as part of our overall mission. So that is our job today. So you can see here, we've got this agenda. I am hoping, we have this scheduled here for 90 minutes. I'm hoping to give at least 15, 20 minutes at the end to pause and answer questions, not just about today's presentation, but also about anything that we've talked about over this past 6 months, acknowledging that, a lot of the concepts that I present on with you all, and I've said this before, may be sort of utopian or may be overly simplistic in terms of the real world and the realities that you all are dealing with and frankly are going to deal with for quite some time, and certainly will be heightened in the holiday season, as we know, both in our personal lives as well as the way in which we work with clients and support them through what are often very difficult times. So I welcome you all to share those realities and to talk through those. And in many instances, when folks do share those realities, it is not me or Christy or leadership that have the best solutions. It's your counterparts and your peers on the call. So leverage those peers and counterparts. You can use the chat It is difficult for me to monitor chat while I'm also speaking. So if anybody would like to interrupt, no harm, no foul, feel free to do so. Christy, you can interrupt me as well. But we'll talk a little bit about housing first and data, some of the key questions we look to answer at different levels, and then we'll transition into a little bit more focus on equity. I think, though, across these discussions, really in any sort of exploration of what you're trying to learn about your programs, some of the very same principles apply. So we're going to nest them in housing first and equity, but you could take these same ideas and kind of transpose them into other domains that you might be curious about with your own programs, with your own staff, and within the systems that you work with. So if you haven't already, please put your name, where you're from for attendance purposes. You can put your pronouns or other identities if you choose. And then I put stick season or mud season because I'm torn on this. I would have said mud season because that indicates to me gardening season, which is a big part of my life in the spring. But then I've been, we do quite a bit of hiking. I was out in the woods this last week or two, and I got to stay stick season with a little bit of a sunset happening, and that sun cutting through the trees is tough to beat. So I'm torn on it. But if you all want to put in what your favorite season is, just to get the chat livened up, feel free to do so. So I'm going to jump right in here, and we are going to start with the slides. There's 2 or 3 slides we've used in almost every session as redefining or making sure we have a rebaseline on what Housing First is. For those of you who may not have been at previous sessions or still need that reminder, and you can see those definitions here. Housing first or housing focused practices is an approach that is centered on the belief that everyone can achieve stability through housing. So the idea being that permanent housing creates the foundation for people that they need in order to stabilize other parts of their life, and that housing is that sort of basic human right that we all are trying to provide for the clients that we work within. And our goal is to quickly connect people who are in that housing crisis, who are experiencing homelessness or perhaps about to experience homelessness, with permanent housing interventions that don't have preconditions on that housing for folks to be able to enter. So things like income or sobriety or treatment. And we've talked at length off and on through this series about the balancing act between committing to housing first while understanding that there are certain requirements, either by funders or by landlords, that we need to continue to meet. And so we don't go in depth here today on this, but we've said before, housing first is not housing only. And the idea of housing first is not that we're providing housing interventions absent the supportive services and the other types of connections people need to be able to maintain that housing in some semblance of a safe manner. We understand that some people will have safety issues in housing, but our goal is to use that permanent housing intervention as a way to help them build a foundation, either to recover from those unsafe situations or practice those different things more safely, whether it be substance use or mental health, or supporting other family reconnections or employment or income, that base being the housing that they live in. And then connecting and continuing to connect people with the supports that they need to maintain that stability and resolve that crisis. In previous sessions, we've talked about the crisis of homelessness, the stress and trauma associated with people who are living outside or in sheltered situations, the neighbors that we have outside our doors right now who don't have a place to put their head tonight or today, may not know where their next meal is, or if they're going to be assaulted or a victim today. That crisis is what we're trying to solve, and we use that housing situation as a way to solve that. So there are different levels that we can think about this from, and today in the data discussion we'll kind of look at this from both of the levels that we've talked about before. One side being on the program side, in terms of how do we ensure that our projects continue to focus on housing as a main driver of stability for people while removing barriers and access to services, thinking about the ways in which our services are person-centered and self-determined based on the goals that the client or the individual or the family brings to us. I've talked in these sessions about my personal examples around goal setting with myself and my family, and I think many others have been able to relate to that, or at least I've heard they have, in terms of others transposing goals on us and whether that is a reasonable way in which we're able to achieve things that other people are striving for us versus what we strive to do ourselves. themselves, allowing then those goals to drive choice and those voluntary services. So at the project level, we are really partnering with people to end their homelessness and leaning into empowering them to help us understand what goals they want to pursue that will lead them in toward a stable housing situation, even if that stability perhaps looks different than the stability that we would advocate for, or the ways in which that stability is achieved is different than the approach that we might take as professionals or as service providers or support systems. At the system level, we also need to support some of these concepts and maybe reinforce them in different ways. So allowing programs to adapt to clients, and this can be in written standards at the coordinated entry level, and creating the breathing room that rapid rehousing or PSH projects need to be able to ebb and flow and flex to meet the needs of an emerging or evolving clientele at the local level, making sure that our systems are client ready, that for our process from assessment to referral to document readiness to prioritization and housing placement are all streamlined and user friendly, both for you at the project level, at the system level for management, as well as at the client or individual level, and continuing to ensure that we can be rapidly intervening when folks are able to move toward a housing situation. And then today's focus continues to pivot toward those data and equity practices. And actually, I think this word driven in the very last bullet of the slide should be changed. It's my own slide, I recognize that. But data, I think it's really data informed is a better way to talk about this. We want to use data, both quantitative and qualitative, to be able to understand the way our practices are turning into outcomes. But we also have to understand that we live in a messy world. We work in a messy field. Human beings are messy, and that the pure data that we are reviewing, especially in a quantitative data sense, is not always the full story. And so we want to be informed by the data inputs that we are trying to pull in to understand how they can breed better outcomes, while also understanding that there's going to need to be flex to that. So when we think about the questions we're looking to explore, and there's a lot on this slide, recognizing that, but some of the primary drivers, right, the piece that we are most interested in from a system level when it comes to housing first, when it comes to equity, when it comes to coordinated entry, are the individuals and families, and I might just use those interchangeably today, so don't get caught off guard with that based on the population you serve, are the individuals or families with the highest barriers and greatest level of vulnerability the primary target for our housing and services. And this means, are we effectively targeting those folks that have indicators that would encapsulate that priority? So those who have the longest time homeless, those may be chronically homeless, and that might be the formal HUD definition or an informal carve out definition that you use to capture those who may be long-term episodically homeless or have been homeless for longer periods of time but don't meet specific federal definitions? Are we looking for individuals who otherwise have not yet been successful in other housing and homeless programs, or those that are currently living on the street or unsheltered locations, or those with significant housing barriers? And there's a role that the system, led by, in this case, the continuum of care with leadership through the balance of state and all of you, can play in reinforcing that question and our ability to get to that question. And that is everything from your coordinated entry policies that prioritize individuals and families with those barriers. It is creating mutual accountability in case conferencing and referral protocols to ensure that as those individuals are being prioritized, that they're actually being enrolled and served appropriately in programs. Because it's great if we have an awesome prioritization policy and the sickest, most vulnerable people in our communities are those rising to the top of that list in that referral system. But if we are not then enrolling them or delivering the services or allowing those enrollments to occur without those arbitrary barriers, then we're falling flat as a system in our ability to actually house people. And there's other functions that the COC plays. And by this, I don't just refer to Christy and her team at the state, but you as a continuum of care, you as an interested universe of people who want to end homelessness, can create accountability. in your NOFO? Are we ensuring that those projects that are scoring well for your either bonus awards or for renewal awards are also being held accountable to Housing First principles? And there are ways that we've talked with the state about doing that and other continuums in terms of using data around referrals and enrollment and negative exits to say, if you don't meet certain thresholds in your ability to work with the folks that are prioritized for your programs, then we can't score you. We're not willing to score you as highly as other projects that are willing to take those risks and to work with those folks that are most in need at this moment in time for our support to exit homelessness. So at the system level, we have our big question, and we have certain data indicators that are available to us via HMIS, via by name lists, via qualitative feedback loops that allow us to translate those into our roles around coordinated entry, accountability, project design, and project funding. And at the program level, we continue to flex that down. So does your program adhere to those Housing First principles in a way that gives you about the ability to flex the approaches that you're using to meet evolving needs? And I think that flex piece is really important. And I don't know how the status of this with the providers on the call here, but I do hear a lot of projects out there and in other spaces of the work that I do that have designed projects that worked really well 10 years ago and don't yet reflect updated promising practice or even more importantly, updated policy considerations. The VA is a really good example of this, where their programs have evolved significantly over the past 12 years, not only in the messaging, now we're housing first, now we're equity informed, now we're data driven, but actually in what you can and cannot do with your dollars. Right? There are VA programs that can do things with their money today that they couldn't do 12 months ago and couldn't do 5 years ago. And it's similar for HUD as new projects come online that we saw during COVID response and some of the lingering resources there, ESG that had some variation to it during the COVID response and other flexible funding sources, and projects that failed or struggled to adapt to the evolving client needs and an evolving sort of condition on the ground of who needs those services, as well as how their funding could serve those people, are the ones who have struggled to be successful. So do our projects use those flexibilities and make sure that we're continuing, especially on the PSH side, to really focus on those most vulnerable, longest term homeless individuals and families without delay. PSH is our most robust line of defense or offense against homelessness for those folks who are suffering the most today. And if you operate a PSH project, you are committing to understanding that that is the population that you're serving. And that may not have been true 10 years ago or 15 or 20 years ago. What may also not have been true 10 or 15 years ago is that the clients that presented as most vulnerable or most suffering the most today had a different profile, a different demographic, a different set of barriers. We know in New Hampshire and other parts of the country, the opioid crisis is a great example. That 15, 20 years ago, those folks that we were seeing who were on the street or in sheltered situations had a different set of vulnerabilities or barriers than we're seeing now in our communities. Similarly, with rapid rehousing, we have to take those leaps from a housing first perspective and an equity perspective to make sure that we are then catching those folks that may be appropriate for PSH, but PSH is not available immediately for them. And so rather than them lingering in the street, we have to adjust our rapid rehousing response to meet those needs. Rapid rehousing is not just a check writing program, right? There is a deep and flexible service package that's both allowable and encouraged for rapid rehousing programs. And in my view, you can design rapid rehousing programs that look very much like PSH, only there's a greater time limit. But you can do a lot within the time that you have, given the flexibilities, at least from the federal side, and even some state resources in certain parts of the country that allow you not only to do 3 months and you're writing the checks and you're becoming sort of an eviction prevention program once somebody is housed, but actually infusing a deeper level of case management services. And that comes down to program and budget design, right? It comes down to the way in which you orient your staff and hire your staff. Further down, and we've talked about this at length in other sessions as the others around, are our emergency shelters actively allowing individuals with those challenges, including folks who are actively using or under mental health crisis? those are the people, the folks that traditionally our country has said no to, that are the ones that are most in need of our support right now? And do we use our limited transitional housing portfolios to create choice-based flexible linkages to coordinated entry? There is a home for transitional housing in a housing first environment. There is a home for sober living and sober environments in a housing first environment. But that home is based on the choice of the individuals that are being served, that they want to pursue perhaps the rules or the structures that that transitional housing setting has in place, or the expectations that are come along with a sober living environment, both on yourself and the folks that you may be living in a communal or roommate situation where there's a commitment to sobriety or recovery to some degree. But are we able to create a system where those folks who are actively pursuing recovery or other types of goals that may require some of that interim period, that we have those resources available, while those who are unwilling or unable at this point in time, or may never be willing or able to pursue those types of goals, also have a place to go and also are prioritized for the limited resources that we have, understanding that there are always going to be, at least right now, more people who need our help than we have help to provide. And so we have to look for those who are suffering the most and have the greatest level of vulnerability. And those are done through things like your policies and procedures, active staff training, one of which will come up later in early 2025 around trauma-informed care, and giving our staff the tools they need to be able to effectively work with people who are in harmful situations, unsafe situations, who may otherwise need a different type of support. Things like motivational interviewing, understanding how harm reduction can meet the needs of a tenancy while also helping people become healthier or more safe in the way in which they approach their life. Conflict resolution to work with landlords and tenants who may not be getting along, right? Coordination with those landlords and tenants to resolve disputes. All of these types of policies and practices are just good practice, but they are nested in a housing focused way. So our data indicators here, I've put in sort of the top line bullet, but the question we're really asking is the sub bullet here. So are we accepting the target group and the priority group of our community and of our project? When we accept them, are we responding quickly to make sure that we're connecting to that individual or family when the referral is made? As that connection is happening, are we limiting the unnecessary delays in enrollment that can happen? And that also includes ensuring lean documentation requirements. I know that's come up a number of times in these calls, like we want to move faster, but the documentation requirements are too heavy. And I've asked you all to scrutinize, are those documentation requirements something that the federal government or the state requires you to do? Or are they programmatically required documentation expectations that are arbitrary, that don't actually lead to getting people housed, and or don't need to be happening at the time of enrollment? There was somebody on a call, excuse me, in our first or second session that said, you know, why is our intake packet 25 pages long? And I said, well, that's your fault, right? And I don't mean you personally, but that's a program decision. There's no federal program where an intake packet is 25 pages long. And if your intake packet is 25 pages long, you can be doing everything right in Housing First. But I would argue that you still have things to work on, including looking for ways to streamline that enrollment. How can we quickly get people connected to the services that they've been referred into or that we're engaged with, so that we can connect that service to them and begin to build that relationship that we talked about in sessions 1, 2, and 3, in particular around that sort of breaking down the barrier and power structures between ourselves and the client. We can't do that until we have created a system that allows people to enroll in projects quickly. As we're enrolling them in real time, are we then supporting, without prerequisite, that active housing navigation, and then moving toward that housing placement and keeping an eye on whether or not we are successfully housing those with the greatest level of barriers, or maybe those from other marginalized groups that have historically been denied housing. And we talked quite a bit about equity, I think, in session 3 or 4, and around the history of equity, and why, while we may be doing everything right, our systems around us, whether it be landlord markets or employment markets or the criminal justice system, lead to marginalized groups often having a harder time accessing permanent housing on their own, and thinking about our role in that from a housing navigation perspective. So these timelines that you can see are sequential, and they should be happening quickly. And that's part of our Housing First response. as folks are housed, are we ensuring that the services we're offering are flexible, that they're responsive to those clients' needs, that they're flexing, as I mentioned, to take away that rigidity of the housing plan and really have it reflect the goals that people are self-determinant in helping create, and then keeping people enrolled in projects and housed, except in the most extreme circumstances. So these questions, right, are the core, and we can look at the data points, right, sort of out of order on the slide, but the data points that help us do that are the folks being referred, being enrolled, how long is it taking from that referral to the first contact with the client? Once we contact the client, how long does it take us to enroll them? Once enrolled, what's that lease up timeline? Once leased up, are the services varying over time? And are there variations in what that lease up process looks like based on different client characteristics? And if so, what do we need to adjust to overcome those disparities or those differences? Are we offering a robust set of services for all of the clients that we're working with? And do they differ based on demographics or client needs? What are the rates of negative exits from our projects? So if you're exiting more people proportionally in your project than your counterpart projects, or that we might expect, is it because you're exiting folks for negative exits that are unwarranted or arbitrary, or do not ultimately solve anyone's problems other than our own, in terms of our own sort of self or preconceived notions about what people should be achieving? Or are you a provider that is actually housing some of the folks with the greatest and highest level of barriers, the very top echelon?
Doug, we lost your audio.
Hey, Doug, you're on mute.
Sorry about that. I must have. When did I stay on mute, Christy?
About a minute ago.
All right. So you can see this question. Sorry about that. I must have hit the space bar. That's the annoying part of Teams. But the questions here really help us drive whether or not we're meeting the kind of core expectations at the program and system level for housing first practices. And each of these are important in helping us understand whether we're meeting our obligations in coordinated entry and whether we're meeting the obligations that we have toward people. So I won't repeat some of the things that I may have been on mute, but it's a way to set us up. So with that, we also have HUD system performance measures. So the previous slide were my questions, our questions to be considering at the program and system level that help us understand from a timeline perspective, from a service responsiveness perspective, from a housing perspective, whether or not the things that we're doing likely align with housing first and equitable principles. We can also nest this in HUD system performance measures, which you're held accountable to as a continuum, and which have an effect on the resources that come into your and my and our community here in the state of New Hampshire. So a lot of what I just talked about and the nexus between these questions and actual program design or system decisions also translate into the HUD system performance measures. So the length of time individuals and families remain homeless. Are we moving quickly to house people? And while the housing market and the populations may be challenging, are we seeing progress in shortening the length of time individuals and families remain homeless? Of those who are leave homelessness are coming back into homelessness, which may be a direct reflection on our ability to flex those resources, as I mentioned, in a way that meets the needs of clients in housing, and also is a reflection of the way our negative exit policies work and whether or not we are exiting folks from programs back into homelessness or whatnot arbitrarily, or if they're evicted, then they're exited from our projects, which shouldn't equal each other. If somebody's evicted, that doesn't mean they have to leave our project. Except in certain situations with certain types of vouchers. Overall, are we seeing those folks come down? Are we seeing the number of people who are homeless coming down over time? Are we linking people to income and job growth? And this one, I think, is important on both sides of our housing first equation, as well as our equity equation with income growth, because the assumption from the basic line is, in order to meet this system performance measure, we then need to make sure that we're serving people who have potential for income growth and job growth. I think that is true in the sense that we have a responsibility to work with people to maximize their income. There is no world right now where income is not important in housing stabilization, particularly for non-PSH projects that don't have fixed income levels or have a sunset period on rental assistance. On the other side of the coin, this is also saying we can house people with very limited employment and income, knowing that our service packages are going to help them grow that. So we are going to house people with the lowest levels of income, with zero income, and support them with our projects, rental assistance, and voucher systems as we grow their income. So there is not a disincentive in this particular performance measure to cream out those without income. And in fact, those who have very limited or no income give us an opportunity to meet this performance measure by linking our housing services to also looking at opportunities for income growth, either via benefits for those who can't work, or and certainly more ideally for those who are willing and able to work through employment or a combination of both. That then translates to success in reducing the number of individuals who become homeless. This is more on the diversion side of the plate. In those services, are we able to place people directly from street outreach? I think this is a really important component right now coming out of the Grants Pass Supreme Court decision. I know we've seen it in parts of this state where there is this renewed sense of criminalization of homelessness. I don't know that it's gone that far, but we're in New Hampshire, though there are some indicators there. And displacement issues that are happening in other parts of this country that I work with. They are arresting homeless people for being homeless right now. And the ability for those communities to respond is being able to do that direct placement from street outreach into housing settings with maybe very short-term stays in transitional, safe haven, emergency shelter stays, and things like that. So the point here is that our system performance measures that we're held accountable to with HUD, as well as the core questions from a practice point of view at both the program and system level, all point to a very similar sort of nature of the work that we're trying to achieve. Are we focused on the types of services and connections that we need in order to focus to house and provide services to the people with the most vulnerabilities and barriers in our system? Are we quickly moving to connect those people to services that they're willing to take? Are we working with them in a way that helps them determine the types of goals and housing needs that they have, and then using our navigation services to get them toward those housing opportunities, and then creating stabilization packages that flex in a way that allow us to provide that overall service that is going to connect them both to mainstream, permanent housing, community-based support services, family, friends, all of those different things that surround all of us in our lives to stabilize us, and then retain that housing over time by being very cautious in how we exit people from programs for infractions or rule breaking that are either arbitrary or exceed or go above and beyond anything other than basic safety protocol or maybe federal or state funding requirements. That is kind of the core of our work. So we can also translate that and those similar concepts into sort of an equity base. And the next number of slides is going to talk about data and equity in a way that is transferable for everything that we do. But we haven't really dug in on the equity side too much in this series. We've talked about its importance. We've shown the graph with the fence and the individual standing there and showing different points where they may be able to reach over that fence, different starting points, kind of the common language. But we haven't really talked about equity from a data perspective and how that helps us advance our systems and why that's important. And the reason that we lead with equity, and I continue to, and I've said this before, and it may be controversial, I think equity became the buzzword of the homeless systems coming through COVID, where during the COVID-19 public health crisis, it was clear and apparent very quickly that there were inequitable disparities in systems across healthcare systems when we looked at the ways in which folks were responding to COVID-19 infection, the way in which our shelter systems were able to respond to those, even in terms of the vaccine rollout. And some of those same things then came into the homeless crisis response system as if it was this new concept that had never been addressed before, that all of a sudden in 2020, all of our systems were inequitable. And we gravitated in the federal response and even at the state level to everything being about equity. And I think there are positives and negatives to that. The positive being that we lifted up realities that existed for a very long time that were difficult to talk about and difficult to define or put vocabulary and ideas around in a coherent way. The other side of that is that I think we actually lost ground in talking about equitable systems as a system and how that applies in the larger context of the work that we do. And we sort of got ourselves into this finite, sort of narrow version of the discussion where everything was gravitating towards slides like this, that we're going to talk about landlords and housing first, and then we're going to do like this little section on equity because we need to infuse it somewhere in order for us to meet the public discourse, and then we're going to come back to the other topics. And in my view, equity is a much bigger and broader sort of set of standards and things that we're striving for that go beyond just thinking about it within a racial equity standpoint or whatnot. The reality is that we do have disparities in our systems. And the reality is that the system that you're all working in, the work that you do every day is often delivered in a way that is trying to meet the needs of various demographics and making those flexible sort of service packages available to meet the unique needs of households, right? To ensure that the best housing plan starts off blank and is determined in partnership with an empowered client who is helping to determine their goals. That, to me, is the essence of equity. But we recognize that many other systems of care in this country do have inequitable outcomes and disparities, and that we often become the catch-all for those inequitable systems. And we can look at all the research and all of that, but I think it's, we can talk about, it's self-apparent, right, that there are racial inequities in this country, and that transcends into our own state. And that may be in the way our education systems work. It is true that our more urban environments in this state, for instance, of New Hampshire, are also those environments where we have the greatest level of sort of racial disparity, but also where we have the greatest proportion of racially diverse people. And those environments are also where, if we look at the school systems, the schools in Manchester generally are rated more poorly than in our non-urban environments. And those schools are generally rated better than the Manchester School District, where my kids go to school. And those school systems are disproportionately more Black and brown than the other school systems. It's not a difficult ledge to go on to say that we can see in our communities that there are differences across the outcomes of the different systems of care. The same with child welfare or the way that we have food available to folks. You could do that within a city. I'll use Manchester as an example. This is actually getting better now in the city. But if you look at the way supermarkets are organized in the city of Manchester, the access to healthy food and affordable healthy food is much greater on the outer parts of the city that are more predominantly white than the inner parts of the city that are more predominantly Black and brown. Those are self-apparent ways that we can relate to the inequities that then lead into longer-term areas of poverty that may lead into longer-term situations of instability. So leading with equity is not just the right side of your screen, it's the right thing to do. We all want to sing Kumbaya and be hunky-dory or use the buzzword of the day. I'm sort of tired of the buzzwords of the day. I think it's really about recognizing that we are that system that is often catching the inequities of other systems. And then we in effect have a responsibility to consider that in the way that the services that we're designing are going to help try to overcome that. It's sort of one of those things where we are making up for, in many cases, other systems of care that have failed different groups, whether it be racial groups, gender, household type. If we think about single parents with children, we know around sexual orientation and gender identity, there's a lot of disparity there and discrimination in those domains, disabling conditions, especially around employment and housing access. There's a lot of different ways that equity come into it. And we can use different types of data to talk about this. And the one, I'm still on mute, I hit the button, okay. One of the things that, and the reason it's the first slide that I think we often lose sight of is the qualitative data side of the house. So whenever we talk about data, and I'm going to talk about this stuff in a few minutes, it is about the numbers and the spreadsheet and the COC report and the APR and all of these things. Those numbers and reports and analytics and all of that are very, very important, but they are not the whole story, and they shouldn't be misrepresented as the whole story. Our qualitative data and our ability to seek feedback loops internally with our teams, with the people we serve, with the other providers who are on this call, with our community are often just as or more important in giving us ideas on how we can better formulate our program. So part of qualitative data is trying to think about how we ask those questions and how we collect information relative to those questions. In previous sessions and in the in-person session, one of the things that we talk about is there may be information that you're trying to get from somebody that is really difficult for them to disclose. We talked about the shame of disclosing our deepest, darkest secrets and the stress that people and the trauma that folks are experiencing when they come to us. The way in which we explore those types of questions that give us then the data, the answers, the indicators that allow us to be planful and service-minded with that individual at the centerpiece, it relies on our ability to ask questions in a way that is going to provide answers that are true and that are genuine and that give us real insights into how we can support those housing plans. And we can't do that unless we are qualitatively understanding the best approach to asking those questions. So that may be discussions with focus groups. It should and must be both from HUD's requirements in limited circumstances and in good practice in all circumstances, informed by people with individuals and families who have lived experience, folks who have been homeless in the past, folks from marginalized groups, folks that are homeless now or in programs that are being served now. Those are our key asset in understanding the qualitative feedback loop of how our programs are working and the questions that we need to ask ourselves and other clients in order to give them the best shot at stability and the best experience possible. We want to center that lived experience at its core. And that lived experience term is also a buzzword that I think has been sort of used in a way that has diminished the real value, right? There's this term, nothing for us without us. And I think it's really important that we embrace that idea, not just the buzzword, but the idea that if we're going to be planful around how we deliver homeless services to human beings, we need those human beings to help us design those services. Because oftentimes we're designing services for human beings and there is a disconnect between what we're trying to achieve with our programs because we had a great idea and we have a big heart and we got a grant to what the folks on the ground who are actually experiencing and suffering need from us. And we have to adapt to that. We can't do that with quantitative data alone. We have to do that with that qualitative feedback loop. So that could be surveys, the observations, the ability to document review documents. That might be where you as a program director or even Christy's team at the state or the COC monitoring experience. Are we beyond the data? Are we seeing through documentation that even though you have more negative exits, there are there's a different characteristic to the case files that we're looking at. The services you're providing are necessarily more robust because the clientele that you're focused on or the tenants that you're supporting have a different set of needs than the other provider. And how do we account for that, not only in what their prioritization score was based on their exit rate, but in conversation with you, right? When coordinated entry was developed, there was this pendulum, and I've talked about this, that swung so far to one side where everything was spreadsheets, right? We're going to assess everybody, apply numbering and scoring to them, sort our spreadsheet and pretend we understand human beings. Fortunately, and I think the state of New Hampshire writ large, to include all of you on the line, have done this really well, and other states are frankly catching up, sort of, is that pendulum has started to recenter across the country where when coordinated entry was released, we sort of pulled out all of that professional experience, that qualitative feedback loop, that ability to think more critically about what's happening beyond the numbers. And it put us in a place where we were trying to be too rigid with how we understood our systems to be and our programs to operate. Now we brought that back to counterbalance, where we have that qualitative data, the document reviews, the lived experience coalitions, the folks who are working in programs, creating feedback up to management through their directors, through their grants, with the continuum as a whole, with the COC board, while the COC board and other partners are also reviewing their data as to whether you're meeting HUD's expectations, the state expectations, but also some of these practices. and we can come to a more holistic solution or at least conclusion about what things are happening. But qualitative data aside, we still need to measure stuff, right? I mean, if nothing else, you have to measure it because you're required to by your funding sources, whether that be the federal, HUD, my SSVF and VA friends on the line, whether that be VA and your, monthly repository reports and your race equity report and those types of things. On the HUD side, it could be your APRs, your LSAs, all of these different reports that are that you all are submitting, which I do not provide TA on, sort of deliberately and admittedly. But we do need to measure things, right? We have to think about beyond just what we're required. Are there measurable ways that we can compare different types of program environments, different types of clients, different types of outcomes that is useful to us? One of the downsides of data, I think, management and the push around data in some spaces is that there are mandates or expectations around data management that aren't useful to you. So to the extent that it's above and beyond what your funders require, we want to look at data that is useful to you, right? So whether it be via HMIS, whether it be within your own programs, whether it be supplemented by name list process that might pull in other data points. But, thinking about the sort of quintessential, who, what, where, when, and why of the types of data we're collecting and how that then and whether that then translates to something that's useful for us. So they're both example, right? And there's both examples, and there's an example here, but I'm going to just give you one that I think is really instructive. I've used it before. If you've heard it, I apologize, but I think it's a great pairing of these two concepts between quantitative and qualitative data at the project level that is not overcomplicating homelessness. So there was a rapid rehousing provider. Again, I've used this before, so I apologize, but I think it's good. Who was providing services generally to individuals experiencing homelessness, and they were, seemingly providing the same level of service or adapting those services based on the needs of the client, kind of doing everything that I've talked about for the past 6 months with you all, and they were adapting all those good things, right? And what they saw in their quantitative data was over time, they saw that between two cohorts, one being adult white men and another being adult Black men, that after exit, the African-American cohort or Black cohort was coming back into homelessness at higher rates than their white counterparts were. And in their data, so their data indicated something was wrong. That was the quantitative side of the house that gave them an indication that something was happening where even though their services looked on paper to be generally equitable, to be generally robust for both groups, regardless of race, that men of color or African-American men in particular were coming back into homelessness, not sustaining their housing in higher rates than their white counterparts. So they used that quantitative data to do more exploration. And in their quantitative data, their numbers, they couldn't find the explanation. So they started a qualitative data process, which is just a fancy Doug Tatro TA way of saying they started to have conversations. And they started talking with the folks in their programs. They started talking with some of their specialized service groups, like their employment navigator and benefit navigators. And what they realized in that is that while on paper, these two groups had very similar outcomes when it came to their income and healthcare connections and other indicators that we use for exiting cases, right? We want to look at, are they making enough money to sustain their housing? If not, do we get them into the voucher? Look at whether or not they're connected to healthcare, like those other stabilizing factors to surround people as they're leaving our rapid rehousing programs. They realized that while like the rates of employment and income were similar for both counterparts at program exit, the duration of those employment outcomes was shorter for Black men than it was for white men at program exit. So their employment was more precarious, was more in its infancy. It had less teeth to it than it did for their white counterparts for other reasons that, I think they made some general conclusions about, but they couldn't, prove or demonstrate it. The general conclusion was taking longer to get those folks employed. And therefore, when they exited at similar rates over similar timelines with similar employment status, that employment wasn't necessarily as solid. And therefore, folks were losing employment. They weren't supported by the project anymore, recidivating back into homelessness. So They used quantitative data to understand that they were having different outcomes among racial groups. They used part of that along with qualitative discussions internally and with their clients to understand why that was happening. And then they made a simple program adjustment. They started doing an extra layer of program exit policy where there was more of a sort of case conference internal discussion around whether or not an individual was, quote unquote, ready to be exited from the program based on not just what they could see in an APR or in a quick data run, but based on the actual conditions of their tenancy, their employment, their income, and other connections, and what that and the sort of the robustness or the hardness of those conditions in that person's life. And in doing that, over time, what they saw was not only did their African American cohorts rates continue to improve, but so did the rates of their white counterparts. So everybody won in this case. It's a concept called targeted universalism, which I think is again an overcomplicated term for what it means. But what it really means is, can we look at our program adjustments not just to address the disparity in one group, but how can we address it where the whole tide is riding, right? The ship rises with the tide. And so they put this extra layer of case conferencing and exit with management and with teams. They put extra consideration into the sort of hardness of these services folks were involved in, and they saw their overall outcomes improve, both as a full cohort, but also with that group that had disparities at the front end. This is not complicated. This didn't take years. It didn't take a data scientist or your HMIS team to come and run all sorts of reports. It was self-evident that there was folks from one racial group doing more poorly than another at program exit. They asked some questions. They had some discussions over the course of a period of time. They made some basic adjustments to their program, and everybody was better off for it. They then had to make those same adjustments to their program design, because if you start to scrutinize case exiting, you also start to realize maybe you're underserving some folks. Maybe you're not keeping folks enrolled quite long enough. Maybe they are going to need more financial assistance than you've been used to in order to produce those better outcomes. So you have to adjust those projections and budgeting, right? It transcends from that system, from your HMIS and data, from those conversations and qualitative feedback loops locally, all the way down into your finance team understanding that, or your grant manager understanding that, you would pitch serving 40 people this year, but it's probably going to be 38 because you're realizing the subsidy packages that you had projected are not enough to bring the successful outcomes you're looking for. And rather than serve more people poorly, you're going to limit that number of people just a little bit more so that you could serve those people that you are serving much better. So those are very simple examples. And I think every one of you could look at your programs and probably recognize, whether it be across gender or race or age or disability or family status or whatever the disparity or the group or the identity may be, that there may be areas within your programs that just require simple fixes. We don't need years-long discussions and data runs and analytics to understand that there are some folks that are not doing as well as others, and that we can make some general guesses at why that's true and make some program adjustments to try to adjust it. And if it doesn't work, we make the adjustment again. So that sort of notion that stagnation in our programs leads to stagnation in our outcomes. And the way that we understand that stagnation in our outcomes is both through quantitative data, what are the numbers telling us, and as importantly and often forgotten, that qualitative feedback loop that gives us an opportunity to really dig deep and explore, use professional understanding and those lived experience to better understand the programs that we're designing, programs that we're implementing, the programs that we want to improve. So we use both of those, and there are different ways to think about access across data, right? And this is within an equity lens, but you can think about this in any lens that you'd like. We applied it here as sort of the topic of this final training, but you can transpose this across, housing first, equity, any number of lenses. But thinking about how we access information, what the output is of that information, what are we trying to then translate that into, and then what is the outcome of the information and what we're trying to achieve. And outputs and outcomes are very different. And I think it's important, even if you don't care about data at all, it's not your job, it's not what you do, to understand that just because we see, for instance, as an output, the number or type of services that are being delivered as an indicator of success, those types of indicators don't tell us anything about whether we're being successful. Those outputs, the types and depth and breadth of services we provide as an output from a data perspective, should then inform the outcome, which is whether or not people are stably and permanently housed. So just because you deliver more services doesn't mean you're actually creating better outcomes. And it doesn't actually mean that just because you're scaling up services for somebody who's in crisis doesn't mean the outcomes are going to improve if those services are either misplaced, mistimed, or inappropriate for the situation. So the way we access data, the outputs that help us inform whether our outcomes are being met are all important factors. And when we think about access, we have to start thinking about, and this is both from a numbers perspective, but also from the qualitative perspective. What universe of people are seeking those services? What is the workflow and how we understand the needs of those people? Where do we build that workflow in, and how do we create consistency? And so this is a slide that sort of puts that into a little bit of parlance, but we talk about this. If we bring it back down to the direct service level from data, what are the ways in which we engage with people at the front end of our system? What is that universe of people who are seeking services or are in crisis who we're engaging with? What's the data set? What do we want to understand from that person? In order to understand it, how do we order the conversation? In previous sessions, we talked about slowing things down and opening conversation and allowing trust building. What does that workflow look like? What environment do we do that? And then how do we create a consistent approach to that so that we can begin to interrogate the data system that we're looking at and the system that we're looking at? So this is one example that we may want to get to. We have this total population. Within the population total in, say, the state of New Hampshire, of that population that we're looking at folks that may be lower income or in poverty or who have some sort of indicator of housing instability. And as we think about equity, but you can apply this to housing first, you can apply equity to folks with criminal histories, equity with substance use. That word is not just confined to race and gender. It is a broader context that we can apply that to. Of that universe, we want to better understand, are there racial disparities or gender disparities? And we can break that down further. Within a racial group, is there a gender within that group who is more or less likely to become homeless or need a different type of service? And so the veteran space is a good one here. And I use this example again. And this sort of, I think, maybe breaks down some of the ickiness we feel about racial equity just being focused on folks of color. In the veteran space, what we are seeing right now is a younger cohort of white women who are becoming homeless. So the bell curve on the veteran space has always been that it was always middle-aged, sort of white men and African-American men who were our veteran homeless population, but as a general rule based on the data. That bell curve is switching now, where those younger populations are growing, and in particular, younger women. And we're also seeing an older cohort on the other side of that inverse bell curve. And so if we want to better understand what is happening in that space, this gives us the ability to do that. We can say within the total population, we are seeing a growing number of low income or housing unstable veterans. Within that, let's apply age instead of race. We can say, we know there's a younger cohort of veterans that are coming up, and now we're seeing a disproportionately larger number of women or female veterans who are homeless as compared to those veterans that we saw in the past. And how do we adapt our services, right? For anyone working in the VA space, we know that the VA is trying to catch up to the fact that they're now serving women that they never served before, that the 50-year-old Vietnam veteran is no longer necessarily the primary driver of the healthcare system on the VA side or some of the housing systems, or they are now a smaller subset of that system. So what does that mean for adapting our services? Well, in the VA space and in this space, we can apply that to youth and young adults. Rapid rehousing for young adults is a different animal or a set of conditions than rapid rehousing for somebody who's 40 years old, who went through an income or health or family crisis, who needs 6 months, 3 months, 9 months, 12 months of help to get back on their feet, who have had a lease in their name before, who have been employed before, who need to overcome some major life crisis to get back in housing. That's different than an 18-year-old, transgender female who was kicked out of their family's home ended up in a foster system for 6 months, aged out of that, has never had a lease, and is showing up at the front door. Rapid rehousing looks different for those two different groups. The same as the healthcare and housing interventions for a young female veteran looks different than the the service and healthcare and housing interventions that we're going to apply to a 65-year-old Vietnam veteran who is now going to elder phases and needing geriatric care. So as things evolve, we look at the universe of what we're trying to understand, and we can distill it into different subparts, not to create more identity politics. We have plenty of that, but to create smart decision-making protocol that give us an opportunity to make adjustments to the services we provide so that we can meet the emerging needs and we're not stuck a decade or 2 decades ago. So as we think about our data, both quantitatively and qualitatively, we have to make sure that the things that we're asking are understandable, that it's a comfortable session, that the interviewers are doing active listening, which is part of our cohort for in-person that was canceled last week. It would be a little more relevant if we had that. Do you, as a practitioner, understand what it is you're trying to understand about the person and what that's going to inform in their housing plan? And do they understand what the intent of the data that's being collected is for as well? So it could be the intent is I need to get you enrolled with the HMIS basic, universal basic data elements. Or it could be the intent is I want to get to know you in a way that helps me help empower you to shape the narrative of your housing plan moving forward. Both of those reasons for understanding data are valid, right? We need the basics to enroll people, but we also want to understand what people's motivations, what their fears are, what it is they want to achieve in order to develop the housing plan. But we both have to understand that. So data, as I said, at the very front end, I am not an HMIS TA provider. I am not a statistician. I like to think about data as a broader, holistic discussion around how do we communicate with people in a way that gives us the feedback loops, both in the numbers and qualitatively, that allow us to build both our direct services with that client, our projects, and our systems in a way that is best responding to the needs in the community. There are other considerations from an equity perspective that are important here, and this is not just racial equity. This, again, I want to get us out of the sense that equity is just about targeting a racial group. There's been enough emphasis there. There's enough training in that space. That's not the space that we're training on today. But do the people collecting the data share identities with the people providing the data? That's actually a newer sort of set of questions that have come up in recent years, but it's really important. And I think, you can put yourself in this position. If you are from a specific racial group or age group or gender, and you're an outreach provider or you're an intake specialist, you're a case manager, and you are working with people that have completely different racial, gender, age, religious identities than you do, that is not to say that you can't provide really great services, but are there inherent downfalls or shortcomings of your ability to connect with people? Am I the best person to connect with an older African-American woman in the community who has experienced multiple bouts of trauma in their life, including trauma from white men like me, and now is living in downtown Manchester or Concord or up in Plymouth or in any area of this state? Am I the one who is going to create the most meaningful connection with that individual and be able to provide the safety that they need in order for them to open up and be empowered to share how we can end their housing crisis? Maybe I am the best one, but it's more likely than not that there are other people on this call. And I point here because my screen, your faces are over here for those off camera. Those on this call or those in your projects or in your staff are better to connect with that elderly African-American woman than I am. Now, maybe you don't have the opportunity to do that. It's not true that you all have the budgets that you need to just hire people from all these different diverse backgrounds all the time so you can meet every little niche that may be out there. But thinking about how we pair staffing so that we have people of varying types of identities represented in the work that we do. And that may be across racial lines, religious lines, gender lines, family composition. Is a mother with 2 children who's a single mother, is somebody else who has been homeless or in a crisis and has also been a single parent with children, a better way to respond or connect them in a peer environment than somebody who's a professional outreach worker? Maybe maybe that's pairing that. Are we making sure that those traumas that people have experienced and most certainly are experiencing now are accounted for in the way that we communicate, that we're asking the questions and approaching these conversations in a way that tries to reduce re-traumatizing people and give people an opportunity to breathe for a minute, right? To de-stress, as we talked about a couple of sessions ago, to recognize that trauma is part of the package that has led toward their housing instability. And can we do that in locations and in settings that feel safe, that feel confidential, that ensure that we're overcoming language barriers or other types of barriers? Are we limiting data collection to what's actually needed at that time? And this is what we talked about in session 2 or 3 around infusing diversion practice and making sure that we're not inundating people with everything about their history the minute we meet them, so that we can put it in a computer and type notes on our laptop and then give them the bed for the night and put them on a list somewhere. And I'm not saying that any of you are proponents of that approach, but that is an easy approach to fall into because of our limited labor hour, right? And the requirements we have on us. So can we use data in a way that is iterative, that is progressive, that builds on itself, so that we're understanding the things we need to know now to keep you safe? We're understanding the things that we need to know now to help de-escalate that stress and trauma. And then we're continuing to understand more to help develop that housing plan, that stability plan, that exit and sustainability plan over time. So there are different ways to think about that, right? And these are some of the ways that we talked about earlier in these slides. But if we think about data that we want to interrogate at the system level, these timelines, the types of services, the length of times across, the types of engagements, the way referrals are made, the way that those are mediated once that referral are made, all of those are indicators not only of our commitment to equity or housing first or housing focused practices or any other term that some TA provider like me came up with to overcomplicate homelessness, but in fact are really getting down to the root of what we're trying to do, and that's deliver high quality services, trying to save lives. And we can examine our ability to save those lives using these types of different data interrogation and looking at what is our overall performance? What's in the system? Who's obtaining the goals that we're trying to achieve? What are the unsuccessful outcomes that are happening within the system that we're working in, whether it's the entire population, whether it's subpopulations, whether it's certain program types, whether it's your city, your town, your county, your project, whatever it may be. Of those who are not successful, who's returning and recidivating into homelessness or exiting our program? And then how do we reevaluate the goals, right? And this slide is set up from a system perspective, but you can do this at the project level. You can do it at the client level. What what are the number of services we're providing to this client? Are those services being successful? Which services are being not being used by the client, or we're not successful in delivering to the client? What services are then being dropped off or otherwise being ignored? And how do we readjust the service plan to better meet the needs and realities of those particular clients? So whether you apply it at the system level or the client level, it's a very similar cycle. I know, there's a couple square peg round hole things there that I just said, but generally speaking, what is the goal we're trying to achieve? What's the universe in which we're trying to understand it right in this moment? Individual, project type, system, community. What sort of information do we need to understand that problem? What other information tells us what's not working, and how do we readjust goals and readjust approaches to meet the needs that we have? So we want to make sure we're weighing the impact of that data and not ignoring those smaller variations that may be out there. In New Hampshire, if we go to race equity, the variations may be very, very small. We are a predominantly white state. So our variations across racial groups in the state of New Hampshire are not going to be, or hopefully shouldn't be, significantly large numbers that they're jumping off pages at us. In some situations, a small cohort may be very predominantly under or overrepresented in a particular outcome, but they may be hard to spot on the spreadsheet or the graph because they start as a small cohort. But proportionally, if that cohort is seeing worse or better outcomes than others in any sort of significant way, then we know that there is something that is worth adjusting or embracing in the services that we're doing. So when we use percentages or averages or big statements that say everybody or everyone or I heard or they said, we often can disregard in that way unintentionally the most marginalized groups. I think youth in particular fall into this space, and then even further, if we look at transgender youth, that is a space where that cohort can be very, very small in a state like ours, if even fully represented. But the outcomes for that group may be disproportionately worse because of the way our programs are designed. And I don't know your data. I'm not suggesting that's true, but those types of cohorts that really do need more attention, but because they're marginal on the graph, don't necessarily get that attention. So thinking about where significance actually matters. It may not be statistically significant for it to be qualitatively significant to how we to design our programs. And that's where that quantitative and qualitative balance comes in. So we think about equity in these different spaces, right? There's the recognition of our community that we are acknowledging that these disparities exist, that we are trying to overcome them just either based on the science or based on our good nature, that we recognize that there are some people who are having a harder time than others, and sometimes and many times that harder time as a result of certain characteristics, racial, gender identity, religion, age, disability, whatever it may be, and that we're trying to create diversity in our leadership and decision making to overcome that we're bringing those voices that are most impacted to the table. I'll bring up youth again. I think frankly New Hampshire is a leader in this space to some degree. I've heard really good things about some of the YHDP work and this active, proactive empowerment of young adults and youth in the state of New Hampshire to inform how these projects are designed. And now, whether or not that's what you wanted to do or it was forced on you by the YHDP program regulations is frankly not that important at this point, because we've seen the results. I've been in some of those focus groups, the ones that you know all much better than I do, where we've heard from youth and young adults who have been in your programs or in your programs, and their feedback has directly translated to changes. We changed the court entry policies and scoring mechanism to address concerns that some of those folks had. We wouldn't have known had we not had those conversations. So thinking about those folks that are impacted, and then making sure that we're giving those folks the ability to advocate, and that we're advocating for those folks to be at the table and thinking about the ways we can support them when there may be pushback, right? And I know there's allies, quote unquote allies within this network that make sure that where there's a marginalized group, you are then advocating with leadership. You advocated with me. I'll use myself as an example. Last year when we were working on coordinated entry, you came to me and others at the state and said, something is wrong here. We need to have a conversation. We need to push back to leadership, right? Not that I'm in a leadership position in the community. I just come in from the outside in this professional setting, but push back to leadership to try to overcome changes. So, and I just skipped to the last one. I apologize. So we may see that, and what we often see is sort of these different responses to equity. So for those of you who are hesitant to embrace like the equity language, right, or the buzzwords of the day, I don't care what language you use, but I do think it's important that we recognize some of the sort of reactions that we have often, and recognize that regardless of the trigger words that are out there that get played in the media and everybody gets hyper focused on some niche thing like equity or housing first, and that doesn't work, or we don't believe in that. That there are telltale signs of when conversations happen that equity is involved, right? Well, folks might think we don't have people of color in the system, or our geography is predominantly white, which is true in New Hampshire, or we know that white men are the ones who don't have access, right? So that kind of pushback to this overall narrative around it, or that we can't prioritize this because we have other priorities. We already looked and there's no disparities. We don't operate like that. We don't treat people differently on the basis of color and of their skin. That idea of color blindness, which is actually not a useful sort of way to think about equity. So as we think about the pushback that we do encounter, that we may feel, that I feel in my personal life sometimes around some of these issues and professional life, we have to recognize that if we're going to have that pushback or be defensive about the way these conversations happen or not believe it, that we have to then look at the data. We have to understand what's real and what's not just in our limited lens and view, but as a system and as projects. You may not think disparities exist because they don't. they're not the folks walking in your door, but it may be that they're not walking in your door because the project you have set up is not welcoming to that particular group, or that you have not yet discovered the way in which to do outreach and inreach to that group of that particular identity, right? There's an example in a city outside of New Hampshire that I've worked with, a larger city that has a significant Chinese population. And in their homeless data, they show that the number of folks who are identifying as Asian descent are very, very low as compared to the overall number of people living in the city in their census. That number is very low in their homeless population. And so they said, great, we don't have that disparity. We are overcompensating on the equity front with folks who are of Asian descent. We don't have any work to do there. And what they discovered over time was it wasn't that folks of Asian descent were not homeless, it's that they didn't know how to find them, because in their culture, there was a different family dynamic and a different dynamic of community response when people were falling on hard times. So what they ended up with were more people who were doubled up or in unsanitary or unsafe situations with family, where you had very small units with many, many family members, which definitionally on homelessness, we won't get into doubled up and prevention and rapid rehousing. But as a general rule, what they discovered is there were people suffering in that community that they didn't know about because they didn't address or account for the cultural and historic underpinnings of that community that led that group of people to be less visible or less visible to the system that they were working in. So they did more proactive outreach within these areas where folks lived, and within the business community that worked with those folks or were represented by those folks. And they actually identified that there was a whole cohort of people of Asian descent that were really in crisis, that needed services, some of it homeless services, quote unquote, some of it other housing, mainstream housing, and some of it just other types of connections to the community that they wouldn't have been able to access had they not adjusted their outreach and inreach to address the fact that those cultural norms existed. So that's an example across an ethnic or a racial line that is particular to that city. In our city, we may have the same thing. I'm French Canadian. I know the west side of Manchester is all the French Canadians. There may, and I don't know if it's this extreme for that group, but there may be cultural norms in that group that lead us to a place where we have more trouble accessing that group. Maybe our church outreach isn't hitting the 3 or 4 French Canadian churches on the west side of Manchester, and therefore we're missing some group of people that are relying on that community norm for help when we could be trying to support that or to connect them more fully to it. So one of the concepts that has come out of this is around race equity analysis. And we're not going to get into this deeply. We're very limited on time. But thinking about the way, and you can apply this to a gender analysis, you can apply this to anything else that you have data on, is how we can think about different analysis. So who's included in that data, the data we're collecting, what the story is behind the data, the strategies that we're going to employ to overcome what we've learned, what that impact is, and that we're trying to learn, our ability to reevaluate whether what we're trying to achieve is happening, and then refining again. Again, that goes back to that example I mentioned of rapid rehousing, refining our programs, refining those touch points, making those adjustments within our federal and state funding allowability to overcome those. So we can identify who we're trying to do that with, why that's happening, what we can do to make it better, how we're gonna know if it's better, right? So we can't start testing things unless we know what it is we're trying to test and what that test is going to tell us, and how do we make changes moving forward. And that can be very simple: case conferencing and exit planning to make sure that our rapid rehousing clients are set up for success, or if we have to give them another month, 6 weeks, 8 weeks of assistance to get them to that point where that stability exists. And these slides will go out, and I know I'm moving quickly because I do want to make sure we have some time. There are some other data tools, just want to highlight or whatnot. These are accessible either to many of you or to your balance of state partners, either at the state or with your HMIS team. There's Stella P, which allows us to project using historical data and assumptions, different impacts that different types of changes to our system would have on different racial groups. This is specific around race. We also have newer tools around what's called EVA data analysis, which allows you to break that down both into intersecting as well as exclusionary groups. Those are concepts we're not going to get into, but gives you greater granularity to the data that you're using. These are all produced by HUD and provided free to COC should they be meeting their reporting obligations to HUD on that annual cycle. Also gives some indications that are similar to your APR that talk about project starts and ends versus the equity tool that's most based on a calendar year. This is the race and ethnicity COC analysis that gives you some snapshot opportunities around where your populations are of all people. What are the different subpopulations within them and how do they interact with your programs? Are there differences between race and ethnic groups in terms of their progression from homelessness to referral to services, housing, and so on? And that is where I was hoping to give 15 minutes here. We've got 9 minutes. I wanted to pause. This is the end of our virtual series. We are going to come back together in January or February. We're going to talk about schedules later. For an in-person that will dive more deeply into motivational interviewing skills, active listening, trauma-informed care, sort of a 101, 201 on those topics in a kind of a one-day time frame for direct care staff to include hopefully quite a bit of discussion so that we can share each other's ideas rather than just hearing me because 90 minutes I think is quite enough, but we will be together for that in-person training for 6 or 7 hours full day and go from there. So I have not been able to look at the chat. I'm going to pull down the slides and welcome if Christy or anyone else on the line wants to bring up any questions in the chat, or if there's anybody else that would like to open up questions, concerns, or other interests they may have on any of the topics that we discussed over the past 6 months. So
I'm not seeing any questions in the chat. Amanda, you and I can talk on Friday. Does anyone, if you want to raise your hand or speak up. They're a quiet group today, Doug.
there's a lot of Doug talking. I understand. Getting a lot in at once.
All right. All right. If anyone has any questions afterwards or something comes to mind, please feel free to reach out to me and email me. I will be sending out the slides for this training as soon as I get them from Doug. And I just want to say thank you so much, Doug. And yes, we will be working on rescheduling that in-person training for sometime in either January or February. I don't want to intersect with the pit count. So we're trying to be aware of that as well.
Come on. Yeah. Yes, I not forgot about, but didn't account for that. So absolutely want to account for the pit count and all of the other things that you have to do as well. I will say, unless there's questions, I've acknowledged this multiple times, but I know some of this feels utopian. I know some of it's high level. I know some of it's the TA speak. And I really just want to re-acknowledge like the hard work that you all are doing across the state. I see it. I live here, which is a great benefit to me. I don't get to see the work as well in other communities. I hear about it more, but I see it here. And I know and have first sort of person experience of the challenges you all face. And I want to acknowledge that. And I also just want to acknowledge again that we're coming into a season that is very, very difficult on the clients that you support. But as importantly, it's often very difficult on you all and your staff who are trying to serve those folks through what are often traumatic and stressful times in the holidays. So, we'll talk again down the road. And but I really do wish you all a really happy and healthy and great holiday season and Thanksgiving and the holidays coming up in the new year. I know many folks get to take lots of time off and, maybe just stress out with their family instead of their work. But for many of you and your teams, this becomes the most stressful time, both personally, but also professionally. So just want to say thank you to all of you for the work that you do here in the community that I work in Manchester or live in, and the work you do across the state. It's not unnoticed. And even though we present slides and use TA and federal speak, it is not meant to belittle the very real world that you all are working in right now and the challenges that you face. So thank you all. I'm thankful for you. That's part of my Thanksgiving. And every time I work with folks across the country, I have to remind myself how much harder your work is than mine, and just acknowledge that as part of my own vulnerability. So I appreciate all of you for being here and putting time into this.
Thank you, everyone. And we will let you know when that in-person training gets scheduled. And I hope everyone has a safe and wonderful holiday next week.
Thank you.